Getting pregnant might seem simple, but it's actually a pretty complex journey for sperm. Imagine, a crowded marathon where only one runner can win. That's kind of what it's like for sperm trying to reach the egg. During sex, millions of sperm begin their race from the vagina, through the cervix, into the uterus, and finally to the fallopian tubes. Along the way, they face obstacles like acidic vaginal environments and thick cervical mucus, which act like hurdles on a track. Many sperm just aren't strong enough to complete this journey. Some may swim in the wrong direction, while others run out of energy. So yeah, this is why getting pregnant isn't always easy, even for healthy couples. Sometimes couples need a little help, and that's where IUI comes in. It's like giving those marathon runners a head start. IUI, or intrauterine insemination, is a fertility treatment that simplifies the sperm's journey. Think of it as, a shortcut that bypasses some of the initial obstacles. Instead of depositing sperm in the vagina, a doctor carefully injects a concentrated sample directly into the woman's uterus. This bypasses the cervix and some of the uterus, bringing the sperm much closer to the egg. This process significantly increases the chances of fertilization by ensuring that a large number of healthy sperm are placed at the right place, at the right time. While IUI might sound simple, it's crucial to remember that its success relies on a few essential factors. For IUI to be successful, 3 key elements need to work in harmony. First, healthy sperm. The man needs to have a good number of healthy sperm that can swim well. This ensures there are enough contenders in the race to reach the egg. Second, open fallopian tubes. The woman needs at least one open fallopian tube, which acts as the pathway for both the sperm and the egg to meet. And third, timely ovulation. The IUI procedure must be timed perfectly with the woman's ovulation, ensuring the sperm are waiting for the egg when it's released. These 3 factors are like the legs of a stool. All are equally important for IUI to have the best chance of success. Before starting IUI, both partners undergo some tests to assess their fertility and identify any potential challenges. For women, these tests typically include ovarian reserve testing, which checks the quantity and quality of eggs. There's also the HSG, or hysterosalpingogram, an X-ray procedure that examines the uterus and fallopian tubes to ensure they are open and healthy. For men, the primary test is a semen analysis. This evaluates the sperm count, motility, or swimming ability, and morphology, which is the shape of the sperm. These are all crucial factors for successful fertilization. These tests help fertility specialists personalize the IUI treatment plan and maximize the chances of a successful pregnancy. Alright, so timing is crucial for IUI success. The goal here is to have healthy sperm already waiting in the fallopian tubes when the egg is released. To pinpoint ovulation, women might do a few things. One option is to track basal body temperature. Since body temperature slightly rises after ovulation, this can be a helpful clue. Another method is using ovulation predictor kits. These detect hormone surges that happen just before ovulation. And then, there's ultrasound monitoring, which lets doctors track follicle growth and predict exactly when ovulation will occur. Once ovulation is confirmed, the IUI procedure is scheduled. At that point, the man provides a semen sample, which then goes through a special process called sperm washing to prepare it for insemination. So before the sperm is placed inside the uterus, the man's semen sample goes through a crucial preparation step called sperm washing. Think of it kind of like a boot camp for sperm. This process separates the healthiest, most active sperm from the rest of the seminal fluid. What you're left with is a concentrated sample of what we like to call super swimmers, and that's what's used for insemination. Sperm washing serves a few important purposes. First, it removes chemicals and debris, like prostaglandins, which can cause uterine cramping, as well as any dead sperm or other unwanted material. Second, it concentrates the healthy sperm. That means isolating the most motile and morphologically sound sperm, which really boosts the chances of fertilization. And third, it improves sperm motility. The washing process actually enhances the sperm's ability to swim toward the egg. All in all, this crucial step significantly increases the odds of successful fertilization during IUI. There are ongoing discussions about ways to further optimize IUI success rates. 2 common questions often come up. First, single versus double IUI. Some studies suggest that performing 2 IUIs within a single cycle, usually 24 to 36 hours apart, might slightly increase pregnancy rates compared to a single IUI. That said, more research is definitely needed to confirm these findings. Second, the question of resting after IUI. While some believe that resting after the procedure might help, there's actually no scientific evidence to support this. Most doctors advise resuming normal activities as tolerated. Ultimately, the decision to pursue single or double IUI and whether to rest afterward is a personal one made in consultation with a fertility specialist. We often focus on sperm count and motility, but sperm morphology, which refers to the size and shape of the sperm, also plays a vital role in fertility. Sperm with abnormal shapes, a condition known as teratozoospermia, might have difficulty swimming toward the egg or penetrating its outer layer. While it's normal to have some abnormally shaped sperm, a high percentage of them can impact fertilization. The good news is, lifestyle changes, like quitting smoking and improving your diet, can sometimes help improve sperm morphology. Fertility medications are often used in conjunction with IUI to stimulate ovulation and increase the chances of pregnancy. These medications, which come in oral or injectable forms, help women release multiple eggs during their cycle, boosting the likelihood that at least one egg will be fertilized. However, the decision to use fertility medications really depends on the couple's specific situation. For women with irregular ovulation, these medications can be highly beneficial. On the other hand, for women who ovulate regularly, the benefits of medication might be less pronounced and should be carefully weighed against potential risks and side effects. The IUI offers a minimally invasive and cost-effective treatment option for many couples struggling to conceive. It's particularly beneficial for couples facing unexplained infertility where no clear cause has been found. It can also help in cases of mild male factor infertility, where sperm count or motility is slightly low. Women with cervical factor infertility, where cervical mucus hinders sperm passage, may also benefit. And for same-sex female couples, IUI with donor sperm is a common and effective path to pregnancy. While IUI doesn't guarantee pregnancy, it significantly increases the chances for many couples. If you're facing challenges conceiving, talk to your doctor or a fertility specialist to see if IUI might be the right path for you. With the right information and support, the dream of parenthood can absolutely become a reality.